We often think translating something is pretty straightforward, right? Like, how hard can it be to translate a questionnaire?
Yeah, you'd think so.
But it turns out, especially in critical health research, it's way more complicated than it looks.
Oh, absolutely.
Today, we're doing a deep dive into this, looking at the hidden pitfalls of translation and back translation. It sounds technical, but it can actually change research outcomes.
It really can. And this method, back translation, which lots of people see as the gold standard, it's often not used correctly, or maybe misunderstood is the better word.
Misunderstood.
Yeah, it's treated like this simple checkbox exercise, but it's fundamental to research integrity. It needs real expertise.
Okay, so let's unpack that. What is back translation, basically?
So the simple version is you translate something, let's say an English questionnaire, into another language, say Spanish.
Right.
Then you get a different translator who hasn't seen the original English to translate that Spanish version back into English.
Okay, makes sense. You compare the two English versions to see if the meaning got lost.
Exactly. That's the idea. But here's the catch. Meta-studies show it's often done, well, pretty poorly, or it's not documented properly. It gets outsourced, treated like an afterthought.
And that's where the problems start.
That's where the cracks appear.
Yeah.
Because the goal isn't just, literal word matching. It's achieving pragmatic equivalence.
Pragmatic equivalence
Meaning the translation has to have the same effect, the same impact on the person reading it in the target language.
I see. It's not just the dictionary definition.
Precisely. Think about idioms. The HADS study had that phrase, butterflies in the stomach.
Yeah, feeling nervous or anxious.
Right. But translate that literally into a culture where, I don't know, butterflies are pests or just irrelevant.
The meaning's totally lost. Or maybe even funny.
Exactly. You lose the intended feeling of anxiety completely.
Wow. Okay, give us another real-world example. You mentioned the INFORM study.
Yes, this was an Australian study with migrant cancer patients. Really important work. They used a common anxiety scale, the State Trade Anxiety Inventory.
Okay.
And one item was simply, I feel upset. Seems straightforward.
Yeah, seems clear enough.
But when they back-translated it from different languages, it came back as, I feel agitated, I feel worried, I feel insecure, and even I feel disturbed.
Oh, those are not the same feeling at all. Upset versus disturbed, big difference.
Huge difference. And part of the dilemma is that back translators are often kept blind. They don't get the full context.
Or objectivity, I guess.
Supposedly. But in that upset example, one translator picked insecure because they thought it referred to a long-term condition.
But the original item was about an acute feeling, like right now.
Exactly. An acute state of anxiety. So how do you get accuracy if the translator doesn't know the purpose of the item?
That's a really good point. It also sounds like this process can sometimes show flaws in the original English, too.
It absolutely can. Sometimes the source is ambiguous. The Supportive Care Needs Survey, for example, had this scale asking about need, a little need versus some need. What's the real difference there? Very hard to translate consistently.
I can see that.
Or even just inconsistent pronouns, like switching between you and I in questions. The translation process forces you to clarify the source.
So this whole process, this back translation gold standard, it's looking a bit shaky.
It often is, in practice.
So for you listening now, maybe you're involved in research or you just want to understand it better, what's the way forward here? We obviously need a different approach.
We do. And the key recommendation, really, is integration. Bring translation experts into the research team right from the start.
Not just hiring someone at the end to do the back translation check.
No, it needs to be a collaboration, a conversation. The INFORM study did this. They had translation experts embedded in the team, doing pre-testing, cognitive interviews, cultural adaptation workshops.
So it becomes part of the research design itself.
Exactly. The focus shifts. It's not just about getting a back translation that matches perfectly on paper. It's about being confident that the final target language version works, that it has that pragmatic equivalence we talked about.
And that might even mean changing the original English items sometimes.
It often does lead to improvements in the source text, yes.
This really shows that translation research isn't just about swapping words. It's an art, a science, a crucial bridge.
It really is. If we want robust research, especially with diverse groups, we have to get the language right. And that means expert guidance baked in from the beginning.
So maybe the next time you come across a study using translated tools, ask yourself that question. Was translation just a final
Or
checkbox?
was there real linguistic expertise driving that process?
Because getting the meaning right or wrong has profound consequences for what we think we know. It's not just a technicality, it's central to the knowledge itself.